Hey guys, we officially made it through week 1 of remote learning. We've done it. So now we got 2 more lessons before we get through week 2. Starting with, we made it through, we are starting our new unit 7. It focuses on like surgical prep primarily, a little bit on like pre and post op care, but basically like surgical preparation. We're gonna go through the first 20 slides of the new PowerPoint. I'm gonna post the PowerPoint and the notes to Edmodo. There isn't really an assignment to go along with today's lesson, but I'm gonna go through practicing a surgical scrub over Zoom. Hopefully it goes good. There is a rubric for that I'm gonna be posting for you guys so that you're able to see it. So unit 7, so we're gonna start out with the surgical logbook. Contains all the details of surgery from before the surgery, during the surgery, and after the surgery. It's kept for legal reasons to make sure that the animal received the care that it needed before the surgery, that it was given the correct amount of medications and things during surgery, and that it was taken good care of after the surgery. It's primarily done to just cover the clinics, but it's also really good to make note of, like, if the pain medication isn't working, then it's going to be noted in the logbook that this doesn't work, this new medication needs to be given, or this animal was really shown to be susceptible to anesthesia. We need to make sure that we don't overdo it and we give less than we would normally give an animal of that size. The anesthesia logbook is a little bit different. The anesthesia logbook notes the patient's status, like how it's doing when anesthesia is first induced, so when it's first going under anesthesia, how it's reacting during anesthesia, and how it recovers and how it comes out of anesthesia. Inside the logbook, TPR, temperature, pulse, respiration, and blood pressure are all taken every 5 minutes to make sure that the animal's body isn't reacting in a way that we don't want it to react. It's kept a very close eye on because you don't want the animal to get too far under anesthesia that it may not be able to come out. The anesthesia logbook also contains the fluid type and the amount of fluid that the animal receives, any pain medications, and the oxygen flow rates every 5 minutes. It's very, very thorough because anesthesia can be something dangerous to work with. Giving too much anesthesia to an animal can end up euthanizing it. So while the animal is under anesthesia, very careful records are kept to make sure that this doesn't end up happening. Before the animal goes under anesthesia, goes under for something like surgery, some things have to be done. So blood work to test, like, does the animal have any kind of like diseases, what's going to be the best anesthetic to use, a physical exam to look at the animal's body, look at their vital signs, see and make sure that they're healthy enough to go under for surgery. The animal should also be fasting, meaning not eating. Depending on what the surgery is, typically vets will tell you to not give your animal food like 12 hours before the surgery is supposed to occur. So if your animal has surgery at 8 a.m. sharp, then that animal doesn't eat anything after 8 p.m. the night before. They may also do the same thing for water. And before the animal is put under anesthesia, they're sedated first. The sedative just kind of like lulls them in so that they're not completely fighting the anesthesia. Prepping the patient for surgery, you want to make sure that they urinate, make sure that they pee. If you need a urine sample, this is going to be when you are going to go and get it. You want to make sure that their bladder is empty. You want to clip the surgical area, so wherever it is that you're doing surgery. Make sure that the hair is very, very, very trimmed down to the skin. Then you're going to prep the skin with a surgical scrub. With the surgical scrub, we've got a rubric for it that I'm going to end up going over. After the patient has received their surgical scrub, then they're going to be put on the table, and all their different monitors are going to be applied to monitor their oxygen level, their heart rate, all that stuff. So I'm going to pull up the rubric. We're going to walk through the rubric of how to do a surgical scrub. The first thing that you want to do is apply the antiseptic scrub. Apply the scrub to the site. If you're having to open up their chest, then that's going to be where it's going to get shaved, and that's where the antiseptic scrub is going to be put. You're not going to put it somewhere that you don't need it. So you apply the antiseptic scrub to the site. No brainer. Then prep the site with a clean sponge. You don't get an old one, you don't get a used one. You get a clean sponge and you begin at the middle of the site and you work your way out. You never go further out than you have to. You work towards the edges of where the area that's been clipped. And you never start your way out and work it. You always start in the middle and then you're gonna work your way out of it. After you go through your first round, that sponge gets discarded. It's old, it's used, you don't use it again. You get points for not bringing the sponge back to the middle. You only go out. You don't go up, down, you don't go sideways, you don't go out to in, you only go in to out, and you don't bring it back. Then you wipe the site with a rinse solution, and you use another clean sponge, and you follow the same pattern. And you do this a minimum of 3 times. Have to do it 3 times, no ifs, ands, or buts. You have to use a clean sponge after every single time. You always start in and work your way out. If you guys want to practice this at home, what I found was if you don't have like a whiteboard or something, that's fine. I don't think I have a whiteboard at my house, but if you use like a dry erase marker on like a glass window, or if you have like a tabletop, like I'm sitting outside on my patio table, if you take dry erase markers and if you draw yourself an outer perimeter, little X to mark the center, and like some Windex and a paper, 3 or 4 different paper towels, then you're gonna spray a little bit of Windex, work your way out to wipe away the X. You don't want to wipe out your initials, your like outside circle, because that means that you've gone too far. You want to stay inside the circle, but you want to get just on the last little bit of edges. And you do that 3 times. That makes sense. Honestly, the easiest thing that I've seen as far as like actually practicing prepping a surgical scrub. So I recommend it. You want to keep in mind that last step is really important. You got to do it a minimum of 3 different times. So before the animal goes under, you have to consider fluid therapy. Fluid therapy it's kind of like a broad term. You can use fluid therapy for a bunch of different things. You can do it for something easy, like if the animal's dehydrated, then you give them an IV. For quick access in the event of an emergency, if an animal gets brought in and needs to have surgery done or something, and they need fluids administered. You can also administer fluid pain medication. This is going to be the quickest and easiest way to relieve pain in an animal, is to just, as soon as you can, get it into their body system. Or you can use fluid therapy as like an IV catheter for pre-anesthesia, which is what this picture is. where you're inserting into the cephalic vein in order to administer the induction agent. So this is going to be that initial bit of anesthesia. The pulse oximeter, it's used to measure the vital signs in the blood by reading the oxygen. You guessed it. It shows the oxygenation, the temperature, the heart rate, the respiratory rate, all through one device. This is similar to what gets clipped on a person's finger. But in animals, you want to clip it somewhere where they don't have a lot of hair, and they're probably not going to really want you trimming up their one little toe. So a lot of times animals, they'll have it clipped to their lip. If they're out under anesthesia, they'll clip it to the tongue. You can clip it between like the little interdigital pads if you want to, if you have enough to like actually be able to clip it to. Typically, one of the easier things is going to be to clip it to the tongue or to clip it to the lip if they don't have a lot of hair. Okay, that's basically it for that. So more patient monitors, using a temperature probe, check temperature, using a respiratory monitor to check their breathing, and esophageal stethoscope. That is what this is right here. The esophageal stethoscope is placed in the esophagus, so it goes down the animal's mouth, down their throat, next to the endotracheal tube. The esophageal stethoscope, it attaches to the vet stethoscope, and you just push it. It keeps going down until when you attach to the stethoscope, you're able to hear that animal's heart beating. That way you're getting a consistent, you can very clearly hear it. The blood pressure monitor, easily you can guess what that does. And the electrocardiogram measures the electrical currents of the heart. The anesthesia machine, good Lord, this thing has a lot of different parts. In general, though, the anesthesia machine used to deliver anesthesia in oxygen so that the animal is able to lose consciousness during surgery. Because imagine doing surgery on an animal that's awake. So we're gonna quickly go through the parts of the anesthesia machine. First part that you have is the vaporizer, which is going to be right up here. The vaporizer is what converts liquid anesthesia into a gaseous form so that the animal is able to like actually breathe it in. The oxygen tank holds oxygen. It should be checked before every animal goes in for surgery to make sure that there's actually enough oxygen in there to get through the surgery. The pressure valve tells you what the pressure is at. The flow meter, the soda lime canister is really important. The soda lime canister, its job is to absorb carbon dioxide. So if you have, there's two different systems that we're going to get into. One of the systems is going to require the soda lime canister. If you have a system where the animal is going to be breathing in the oxygen and then breathing out back into that same system, then you're going to need that soda lime canister. Otherwise, they're just going to continue trying to breathe in carbon dioxide, and that's not going to work too well. You've also got the pop-off valve, which releases excessive amounts of oxygen to make sure that the pressure isn't going to get too high. And then the scavenger hose also attaches off to that to make sure that that gas isn't leaking into the room. So I think in y'all's notes, you should have a kind of like a layout of the anesthesia machine and how everything kind of connects together. So you have the pop-off valve, and if there's any excessive gas, that pop-off valve just opens so the pressure is released, and then that scavenger hose is kind of there to catch it to keep it from getting in the room. Corrugated tubing, that's just the tubing that allows the gas to flow to the patient, just the tubes. The Y connector is the attachment from the tubing that connects to the endotracheal tube. The anesthesia chamber, if you have a small patient and rather than administering the anesthesia, you want to put them in like a chamber to basically just pump that chamber with the anesthesia so they're able to breathe it in so they'll pass out in the chamber, then that's something that you can also do. Or you can use an anesthesia mask, which is just going to go on the animal's mouth or muzzle so they're able to breathe that in. If you don't have an anesthesia mask to fit an animal, then you're going to want to probably try to use the chamber. And typically this is going to be like when you have like a really small animal, like a kitten or something, and you don't have a mask small enough to like fit them. So you just put them in the little chamber. So here is this layout. Got all the way from the tank down to the endotracheal tube where the patient is going to be. You've got the flow meter, your vaporizer, the CO2 absorber canister. This is the soda lime canister. The pop-off valve and the scavenger bag. And then it's going to end up getting taken to the patient. When you're looking at something like this, it's kind of hard to see how things flow through, but giving it in this layout, you can see like here's the start and here's the end. So here's the two breathing systems that I told you we were going to be getting into. The first one is the non-rebreathing system. You can also hear it called the Bain system, and this little GIF right here, I stumbled upon, and it works pretty well, even though it is a human and it's not the greatest GIF. Basically, the way it works is there's a single tube attached to the patient, but there's also another hose that goes through the tube that passes gas through. So if you look at this top one right here, if we can see it, it goes from the reservoir bag all the way through, and then this is our one tube, but you can see right here in the middle, this darker blue or purpley kind of tube is inside of it. So the gas flows from right here to the patient, and then the patient continues to breathe that back out into that same tube where it's going to go down through here, and it's going to go to the soda lime canister. The soda lime canister job is to absorb that CO2 so that it's not just dumped out wherever. This is a picture of the rebreathing system, which allows gas. It will go away. Maybe it won't go away. Ooh, there we go. Which allows gas to be breathed through the CO2 canister. So anesthesia induction, there's different planes that the animal is in before you can necessarily operate on them. So induction is going to be kind of like that first step. The induction is when the drug is first given to make the animal go to sleep or remain unconscious. Anesthesia, it can be injected into the body. Some animals have to be injected like in the heart. Sometimes, some animals it's easier if they just inhale the anesthesia. But once they're induced to anesthesia and they're unconscious, then the endotracheal tube is going to be placed, because you obviously don't want to be shoving that whole tube down the animal's throat while they're conscious. They're not going to like that. The endotracheal tube placed in the trachea and allows air to flow during surgery. It keeps the animal, it allows them to be able to breathe. You want to check the cough reflex, feel the air passing through the tube, and attach it to the reservoir bag. And the reservoir bag is just the part of the anesthesia machine that is right there. And it moves to show the normal respiration. So it kind of like goes up and goes down to show the animal breathing in and breathing out. The blink reflex is used to determine the plane of anesthesia achieved. So basically like how the animal, if they're blinking, with the size of their pupils. We're gonna get into that in like another slide or two. But continuing with the intubation process or procedure performed by the tech or the vet, pass through the breathing tube, down the trachea, It basically is just done to try to prevent aspiration, to ensure the animal continues breathing normally like they should. So the anesthesia planes, they're measured by different reflexes, the blink reflex, or basically like the palpable reflex by tapping the figure over the eyelid. I'm not saying like poke their eye while you're hoping they're unconscious. Like just moving your finger over or looking like you're gonna tap it is gonna cause them to blink if they're still conscious enough to do that. If you go down to do it and they're like this, they're still very much conscious and definitely not ready to be operated on. Or the pedal reflex is done by pinching the skin between the digits, because this is kind of like a sensitive area. If you pinch it, and I'm not saying like pinch it hard, but if you squeeze it and they pull back some, then it's the same thing. They're still able to feel, and they're not yet ready to be operated on. The first plane of anesthesia is the induction phase, when they're first going into anesthesia, where they're kind of disoriented, they're confused, they're not really sure what's going on. But as things continue, they're going to move into phase 2. They're still not quite under in this phase, where you can see like some involuntary movements, some vocalization. This can be like where they're blinking or when they're like moving, or they might be whimpering a little bit. They're not still fully under in phase 2. So at this time, they still need a little bit more time. And then they're going to get into plane 3. Plane 3 is going to be where they're able to be operated on. It's called light anesthesia because they're under just enough anesthesia that they're unconscious enough to not feel anything. Because like we said, if you give too much anesthesia, it's enough to kill an animal, where it goes from anesthesia to euthanasia. So they're under the light anesthesia. At this time, their vital signs are normal. Their heart is beating at a good rate. Their breathing is normal. They're lying still or like relatively still. You're pinching or moving over their eyes and nothing's really happening. Their pupils are also a regular size. In the chart, I think on the next slide, it shows you how the pupils will change depending on what plane of anesthesia the animal's in. If you accidentally give too much anesthesia, it can lead to an overdose. This is called the deep plane, where their vital signs decrease, their heart rate decreases, their breathing levels decrease, their pupils are like dilated and they're huge, and it could end up resulting in death. So that's why we're really, really careful about how much anesthesia that we give an animal. And some breeds are more susceptible to anesthesia than others. Raisin being a Sphinx and a hairless cat, he has sensitivities to anesthesia that should be aware of, but I always make it a purpose to tell them if he needs anesthesia, they do need to be careful about that, because giving him the normal amount of anesthesia can actually end up being an overdose. So looking at this chart, so the first stage, the first plane is induction. This is going to be the typical size during the induction phase, and if you move like a light over it, or then you're going to see their pupils get a little bit smaller. Their respiration rate is going to be a little bit kind of all over the place, where they're first going in, they're like, and they're not really sure. But then it's like, it's kind of mellowing out, but it's still like, none of these are the same, like they should be. Their pulse is going to be irregular, but their blood pressure should be normal. They're going into anesthesia, so they're not really quite sure what's happening. That's why their respiration rate is a little bit all over the place. The second plane, if they continue, is the excitement plane or the second plane. Their reaction to light is going to be more sensitive than in the first plane, meaning that their pupils are going to get even smaller if you show them any kind of light. It's called the excitement stage because their respiration rate is very up and down. It's irregular, it's fast, and even their blood pressure at this point is high. Their body is trying to fight off the anesthesia at this point. So that's why their respiration is so high. The third stage is the operative stage or the light stage. They're under light anesthesia. They shouldn't have any reaction to light at this point. Minimal reactions to the reflex. Their heart rate and respiration rate should be slow and steady and even. And their blood pressure should be back to normal at this point. This is where you do surgery. And if they end up having an accidental overdose and moving into the fourth plane, then this is where you're going to see their eyes just huge. Their pupils are very, very, very dilated. Their heart rate gets very weak and small, and their blood pressure decreases a lot, which isn't something that you want to be able to see. So that was it for the lesson. Definitely recommend practice your surgical scrub. I wish we were able to practice this in class. I really miss all of you guys. I'm sure y'all are getting a little bit stir crazy too, but I've got Zoom lunches, maybe every other day or so. And I post a link to Edmodo. If you guys have any questions, if you want to talk, catch up, if you're bored and don't have anything to do, feel free to hop on and we can talk. Hopefully I'll get to see you guys soon. I miss y'all, but thank y'all for doing the work, watching the lectures. I hope y'all are getting something out of it, even if it's not as much as we could be doing in the classroom or at your clinic. I miss you guys. Stay safe and take it easy.